It's been about 2 weeks since Prime Minister Justin Trudeau shuffled his cabinet. Some new faces have taken on some key roles, including Mark Holland, who's now the health minister. And he's in Vancouver for an announcement tomorrow. But just ahead of that, he joins us now in studio. So hello, Minister Holland. Thanks for being here today.
Thanks for having me. Glad to be here.
Yeah, always nice to have somebody in studio with us. So, just 2 weeks into the role, you were the government's House leader before. What do you bring into this new role as health minister?
Well, I think we know for every Canadian how important healthcare is. And it's so essential to who we are as Canadians that we have universal, publicly accessible healthcare. But Canadians want to see progress. And, we've invested a tremendous amount in healthcare, $200 billion over the next number of years in additional funding that's going to be going in. But we want to make sure that Canadians see progress and see results. So being out here in BC, talking about what that's going to look like here in BC, looking forward to the action plan for BC, talking about dental, making sure that every Canadian has access to dental care in this country is a huge priority.
And we're expecting a bill in the fall around that?
Yeah, absolutely. And so I come in, a House leader, nobody knows what a House leader does, but, really what it was about was working with other parties to get things done. And this is no different. It's working with Canadians, working with stakeholders to find ways to improve our health system. We have the dollars. Now it's about the action plan to really see those improved outcomes, to reduce wait times, to improve patient access to care, to making sure that every Canadian has access to a dental care and that's not a barrier in terms of the money that they have. So I'm super excited to get to work and really been having wonderful conversations here in BC.
So we know that health is mostly a provincial jurisdiction, but the pandemic has shown us that we need a federal strategy. And the US, UK now seeing spikes in Omicron, and they're saying this is a fall wave. How's the federal government preparing for that?
Well, really, the pandemic was a trauma for everybody, and there were some people who experienced it much more profoundly than others. And those that are on the front line of healthcare, we really have to say thank you. I was at the Children's Hospital in BC today. I'll be in St. Paul's tomorrow. Just really getting a chance to talk to folks who are on the front line about how they had the lived experience. But we as a federal government are working with jurisdictions to really make sure that we understand the lessons of the pandemic. This is something that none of us had lived through in our lifetime, and making sure that we are there, not just in terms of equipment, but with the strategies to reduce the worst outcomes. We had one of the lowest death rates in the world, about 800,000 people, just as a result of our vaccination program, who are believed to be saved as a result of the work we've taken on vaccinations. It's something that we all have to be part of, whether or not it's local community hospitals, healthcare settings on a local level, or the federal government or provincial governments, and as individuals that we're getting vaccinated and we're taking the proper health precautions.
Speaking of lessons learned, just about 2.5 weeks ago, we heard from more than a dozen health professionals right in the British Medical Journal calling for a national inquiry into our response into COVID-19. We had great vaccination uptake. At the same time, more than 52,000 people died. They also pointed out the fact that our long-term care homes, as they call it, was a death trap for many people. Is this something that your government would be willing to commit to?
Well, first of all, I think we celebrate what went well in COVID and, how resilient we were as a community, as communities, how great the uptake was on getting vaccinated and all the death that was averted. We also can look at areas, as you say, like long-term care, where things didn't work and where there were incredible tragic outcomes. And so learning the lessons of COVID to make sure that we have the greatest reduction possible of harm is absolutely essential. And that is an ongoing iterative process. That's something that we're doing in myriad ways right now. And I'm having a conversation today. I was here with, Talib, who's an MP on ours, with the Liberal Party, having a conversation with Don Davies. I'll be talking to Peter Julian tonight. It's just while I'm out here, having conversations with members and having conversation with stakeholders around what's the best and most useful way. Well, it's still prescient. Well, it's still in our minds. Well, that trauma is still being felt, to make sure that we have review mechanisms that really capture the best practices to make sure that, God forbid, that we see another variant or that we see some other form of pandemic, that we really have a much stronger experience and that we can use the learning to make sure that we avoid the worst outcomes.
So that's great that you're having conversations with people individually, but what these experts have said is they want to see a comprehensive review, somebody who's an independent third party, much like we did in 2003 after SARS. Is that something that your government would be willing to do?
Yeah, one of the things that we're doing right now is having the conversations about what is the best way for that process to take place. I mean, evaluation, really looking empirically at data and at practices and having conversations and understanding what we did right, what we did wrong, and how we can apply those lessons is something we're 100% committed to. The exact form that process takes is an iterative process of having conversations, but certainly that's something that we want to have a continued dialogue with Canadians about. We want to do this while this is fresh in mind, while we're just coming out of this experience so that we can really capture that learning, but we want to make sure that we do it in the right way. There are so many different processes that are already ongoing and evaluating that and looking at that. So seeing how a different process might interface with those existing processes is extremely important. We don't want to be duplicative. We want to be as efficient as possible, and we want a process that's going to work and get us answers.
Right. They say that right now the current systems are a bit of a patchwork. So are you ruling out that we could be having a national inquiry?
Well, I think you're right to say that it's patchwork. I mean, I think one of the things that we found was that as we developed the science and data of what were the best approaches, getting that down to the community level and having those the seamless interface of sharing information wasn't always there. Interoperability is extremely important, our ability to share data and understand what's going on, as well as being able to get strong and effective messaging at a local level that people trust. So there's a lot of learning that's there. I think that I understand that wanting to jump to the end of the process. I've been in this job for 10 days. I'm in a data collecting mode. I want to really make sure that we get this right. As I said, this was a trauma for all of us. I don't want to see this visited upon any of us ever again. We want to do everything that we can to prevent another pandemic from ever occurring, to be able to stop wherever possible any loss of life, and to take those lessons and to be as effective as we can. I understand that the desire to jump to the end and to know exactly what that process is, but we want to get that right, and we want to make sure that it's informed by science and it's reflective of what's already happening and ongoing in terms of reviews.
I want to switch gears to some of the concerns happening here in BC. We've been covering this for weeks, months, it feels like almost years now, talking about ER shortages, doctor shortages, ER shutdowns, and those are the places that British Columbians, Canadians really need in their moment of needs. How are you approaching these concerns at this point, thinking about staffing shortages, burnout, inadequate facilities?
Well, so let's talk about workforce first. So we know that across the country, and this is a problem really being experienced by all of our peer countries, that we need more people in healthcare. Now, we have a lot of folks who have domestic credentials that we want to find a way to accelerate, to recognize their credentials, to bring them on stream. We're bringing in a lot of folks from other parts of the world as well who want to live in Canada and want to be able to practice here and be able to serve as healthcare workers. We want to be able to fix the mobility issue across the country for folks to be able to seamlessly and easily move to different parts of the country to practice. And we have to work with the number of seats that are available, the number of students and young people that are able to enter into the workforce as well. And one of the things that's so critical about the agreements that we struck is that they didn't just put dollars there. What we said is that it was tied to outcomes. And one of those outcomes was specifically around workforce, about making sure that we have more professionals that are coming in to meet the needs of folks in British Columbia or right across Canada. So that is baked into the agreements that we got with the provinces. And what we're going to be seeing very shortly here in British Columbia with Minister Dix is we're going to see what British Columbia's action plan is to put those dollars into motion and see how we as a federal government can work on this and other areas to make sure we get results.
So you're looking for some accountability there in that sense. So you're also in town. There's an announcement tomorrow. I won't give a preview of that, but a bit of it is about Indigenous health. What's your government to address some of those gaps that we're seeing in Indigenous and rural healthcare?
Well, I think one of the things we have to acknowledge in healthcare is that we have to take a different approach in every part of the country. What's going to work here in downtown Vancouver is not going to be working in rural British Columbia and is not going to be working necessarily for First Nations people. So we need to be able to take an approach that really tailors what we're doing to those individual communities. So whether or not we're dealing with prevention or sexual and reproductive health, or we're dealing with any aspect of health. We'll be talking about one of those tomorrow. It's really about looking at how we work at a community level to understand the needs at a community level, build up community capacity, and make sure that our approach is tailored to those communities. That can be difficult. Obviously, as a federal government, we're looking across the country. So those relationships that we have at a provincial and local level are really essential. And in specific, in this instance, working directly with First Nations on a nation-to-nation basis to understand what those needs are so we can be real partners in Indigenous health.
And so, your predecessor also signed a big deal, of course, with all of the premiers across the country. And earlier in June, we got a bit of a top-up here in BC. There was a bilateral deal with BC and the federal government. Could the provinces be potentially seeing more money this fiscal year?
Well, yes, they are. You're absolutely right. There's a $2 billion top-up that's right now to help right now with the needs of healthcare. And we've also struck a deal to invest $200 billion more into the health system. But what's different here is it's not just dollars. What we're saying is we have to see improved health outcomes. So we have to be able to see that waiting times are coming down, that patient outcomes are better, that we're seeing improvements across the whole spectrum of the health system, that patients are able to see their records, that those records are portable, that we have better interoperability of our data. So we've created the expectation with these additional dollars to have those outcomes. And what we've said to Canadians is they're going to be able to see it, that will be reported annually, and they'll be able to see that progress. So yes, there's more money, but perhaps even more, well, not perhaps, certainly way more important than that is the indicators to show progress year over year, to show how that money is improving patient outcomes, is improving our healthcare system, so that folks in British Columbia and folks across the country can know that their healthcare system is not only there for them, but getting better over time.
Okay, that's good to know that it's an annual report that we're going to be looking for. We'll be sure to be talking to the provinces about that. And if that, if you don't see the data that you're looking for, could that money potentially be clawed back?
Well, the way that it works is we have a 3-year window. We have to give provinces an opportunity and territories to really put into motion their action plans. So these action plans right now are showing exactly how these dollars are going to go to help fix issues like workforce, to make sure that doctors and nurses are there, how it's going to go to improve patient outcomes, how it's going to improve the healthcare experience. And those action plans are going to detail that. So provinces will be accountable to the action plans that they put out. And then at the end of 3 years, there's an opportunity to take a look at what progress has been made, and then have a conversation about, about what we do at that point based on what successes are there or what progress hasn't been made.
Okay, interesting. And so you've been in the role less than 2 weeks. Is there anything at this point that you think that needs major attention that you're really putting your foot down and focusing your attention on?
Well, there are so many things, but I think I would take a step back and say, that so many of us right now are not in the best place in terms of our mental health, that this is a real trauma that we went through, that when we look at young people, particularly all the issues they're having to deal with the existential threat of climate, of the climate crisis, of what the instability we're seeing in Ukraine, coming out of the pandemic, working with Yara, the minister, Yara Sachs, who's the Minister of Mental Health and Addictions, really putting a focus on health promotion, health prevention, and dealing with mental health, looking down the stream, trying to avoid costs before they become there. So at the same time that we're looking to transform the health system, to make it more efficacious, to deliver better results for people, we want people to not go into hospitals in the first place. We want people to not be sick in the first place. There are so many opportunities. Coming from my background at Heart and Stroke, there's so many modifiable risk factors, things that we can do to stop people from ever being sick in the first place. And I want to see us put lots of attention on there and put a lot of attention on the issue of mental health, because, one of the things maybe we don't think about is the way that health affects our productivity as well, our ability as our nation to have economic input and to make those next great innovations. If our health isn't there, if we're not in strong mental health and strong physical health, then our country isn't going to be as productive and nor is it innovative. So these things are very interconnected.
For sure. It's an outcome we don't always think about, right? All right. Thank you for taking the time to come in to chat with us, Minister Mark Holland.
Thanks so much for having me.